Welcome to the Institute of Oncology Massage. Today I am talking with Amanda from On Point Brow Artistry. Now, Amanda and I have known each other for a number of years now, and I remember talking to her a little while ago about actually mapping the eyebrows for people who have been through cancer treatment and have either lost their eyebrows or they've thinned out. So welcome, Amanda. Thank you for joining us today.
Thank you for having me.
Absolute pleasure. So I am seeing on social media, more so in the last few years, a lot of templates and things for eyebrows being sold. And I actually remember being in a cancer support group recently where a lady had ordered templates and she'd got 50 million different types of eyebrows on this template. And she said, so I've used these ones and I don't need them anymore. If anybody would like to take any of these. But sometimes you look at people and you think, I think you've got the wrong template on for you. So mapping eyebrows is obviously important and is something you're passionate about. Tell us a little bit more about that.
Okay, so mapping the eyebrows is definitely not one size fits all. It's a very personalised thing to do. So it's got a lot to do with your face shape and your bone structure across your brow bone, and the way your even your eyelids sort of under here, how they sit. One could be higher than the other. So yeah, any kind of those stencils, they just don't really align with everybody's face shape and bone structure.
Absolutely.
Yes. So that's why sometimes you'll see some of the brows that they just sit very outside of their natural brow hair, and it just doesn't look natural. And you do want them to look as natural as possible.
Absolutely. So when you are actually mapping for somebody, how long is this process, and is it something you would do kind of pre them losing their eyebrows due to chemotherapy, or is it all right to do once they've lost them?
You can definitely do them once they've lost them. If they have a photo of before, then that's great too. I tend to see a lot of women after, and I do my mapping while they're sitting up. Okay. So because it obviously with all the chemicals, it affects how their hair grows back as well and their skin. So I'll do them while they're sitting up, and it's just all about finding where their natural hair growth was, because you can generally see where the hair follicle was, and it's just measuring up with their eyes, their nose, and the top, and how their eyes sit, and whether they've got like a hooded eye, whether you want to lift it and open it just a little bit. Okay. So there's quite a lot that goes into it. I've actually done a whole course on just mapping. So
oh wow. Wow. Yeah. So it's just not a quick overnight, we'll draw some lines here, draw some lines here. Excellent. There's your eyebrow.
No, definitely not. It takes a lot of practice. And yeah, you can get it quite wrong if you're not taking your time. So pre-drawing before you do your tattooing is extremely important to get it absolutely perfect, and have the client look and make sure that they are happy. And watching their body language and the tone of their voice as well is a huge thing, because sometimes they think, oh, well, so maybe that's how they should be, but it's not about that. It is about how the client thinks they want them, or they know how they want them. Absolutely. Within reason as well, because sometimes people want something a little bit way out there, and you really need to just try and explain that sometimes that's just not going to work for their face shape. So I've had a few clients go, I want them just like yours, and I'm like, we can't do that today. Like, it's just not possible, because it's just not going to work for them.
Yeah, absolutely. Yeah. And shape face plays a huge part. And once you get to the tattooing stage, I mean, that's long term. You're not looking at something that's just going to be there for a week and then you go a week later, I don't like that.
It's going to fade.
it's
It doesn't
an
go.
in fashion for now.
Yeah.
And likewise, that fashion goes out in 2 years' time and there's a new fashion type
New
thing.
fad. Yeah.
So cancer treatment affects the hair, the skin, and we know because of chemotherapy attacking fast dividing cells, being cancer cells, unfortunately, it also attacks the hair follicles because they are also fast dividing cells. So why does it take so long for that to actually grow back naturally, for your skin to feel more like yours, your hair to look more like yours? And what is it that it actually does to the hair?
Okay. So obviously, like you said, it affects the fast dividing cells, so it kills off from the root of the hair, and it can actually cause those follicles to close up. So that's why you'll lose your hair throughout the treatment, and usually within days to a couple of weeks of starting treatment, and then throughout your treatment, and it can start to come back within a few weeks. But what you'll find is your hair comes back a bit different. It can come back a bit wiry. It can come back lighter coloured, possibly lost all its pigment. Sometimes it doesn't really come back at all. And that's just due to obviously the damaged cells, follicles, skin. Obviously, your skin being the largest organ in your body, it just takes a long time to heal and regenerate. And yeah, that's basically because it's just damaging
Everything
all your
that
cells in your
unfortunately
body.
that attacks, yes. So time frame wise, as I said, it attacks from the root. So then you're often still in treatment, or you're out of treatment when it starts to grow back, but there is still that treatment lingering in the body that the body
Yeah.
is still processing and getting rid of. So we're getting hair growing back and skin that hasn't quite healed, I suppose, yet from that intense damage the chemo has done. How long does it really take for, I suppose, the good hair to start growing post-treatment?
It can take up to at least 12 months.
Wow. So yeah,
Yeah,
that's a
so
long
it's
time.
a long time. I I don't even dye or tint people's skin and hair, if when it does start to grow back in that first 12 months, just because you don't know how their skin's going to react, because everything has changed
Yes,
within the body,
absolutely.
chemically changed in the body. So because obviously chemo, dry skin, you
Yeah.
can get pigmentation, discoloration, all sorts
It's
of
much more
adverse effects.
sensitive.
It's a lot.
So
Yeah,
yeah,
very, very sensitive.
putting intense chemicals onto that is something that, yeah, holding off and allowing the body to go through that healing phase first
Yeah,
is quite important.
very,
So,
very important. And because of the sensitivity, you don't know how someone's going to react, especially to more trauma to the skin
yeah.
using the needle. So a minimum of 12 months on somebody who is normally relatively healthy pre-cancer.
Mm.
And then afterwards, obviously, you reassess everything, but
Yes.
minimum of 12 months at least. Yeah.
Because we do know everybody heals differently. And as
Yes.
you say, environmental factors are going to play a huge part on healing, whether that be nutrition, exercise, how you work pre your cancer diagnosis as
Yeah,
well, and what other comorbidities you might have that might also slow down healing.
exactly. Yeah.
Yes, everybody, as well as their face being different and the layout of their bones,
The whole
everybody's
body.
healing is different as well.
Yeah.
Yeah. So you mentioned before about making sure you're drawing the eyebrows on before you're tattooing. I know that you like to do a hybrid dye
Yes.
pre-tattoo. What is a hybrid dye, and why do you like to do that pre the tattoo?
So, because when you're losing your hair and you kind of get used to seeing yourself without a lot of hair on your body and your face, it can be what we call brow shock.
All right.
So I like to recreate your brow for you, and give you time to get used to seeing that again over time, and also working out what you like,
Mm,
the color, the shape, and yeah, because you don't, with the hybrid dye, it will fade. It
okay.
stains the skin, so you're getting quite a defined eyebrow, which you'll see the defined shape. So you can, yep, no, oh, we might tweak this next time. We might change it up a little bit next time.
Okay.
And then it fades off.
So
So,
how long do you kind of have the hybrid dye on for before it's kind of faded off?
well, it depends on the skin type. So it can last anywhere from a couple of days to 10 days on the
Okay.
skin, but it dyes the hair throughout that hair growth cycle.
Yeah.
So up to about 6 weeks. And then you'll come back in and we'll do it again, and just sort of easing you into it, getting used to seeing, looking in the mirror and going, oh, I've got eyebrows. They're
Yes.
always there. I don't have to draw them on today.
Yeah.
Yeah, because the last thing that I want is to scare anyone and have that brow shock when they look in the mirror after having a tattoo, because it goes quite dark in the first week,
Yes.
and it's a bit of a shock to anybody getting it done, let alone somebody who isn't used to having those brows on their face
And
for a
when
long
you
time.
have had hair, not having hair obviously is quite a shock as well. So
Yes.
you get used to what this new looking you is. You have to look in the mirror every day,
Yeah.
and you start to become aware of who this new person is, I suppose. And even if you are going back to having eyebrows exactly like they were before, the body naturally doesn't just put them there. It's a process of that growing back over, as you said, quite a long period of time.
Yeah.
That you naturally just progress with that on a daily basis, from a small amount of hair growing back to getting the full eyebrow back over time. But tattooing is just instant, from
It's
nothing
there.
to something.
Yeah,
And yeah, that's quite a big shock when you have had nothing for a while.
it is. Yeah.
So the tattoo process, how long does that actually take? What's involved?
It can take up to 3 hours or more,
Okay.
depending on the pre-draw. So some people are easier to create that shape than others. So there's a bit of sitting up and laying down. So I'll lay you down, I'll numb it, and then I'll start the pre-draw, and then I'll sit you up and do most of it sitting up as well. That way we're getting everything nice and even, because when we sit up, everything sort of, as we age a little bit, things sort of drop a little bit when we go from laying down to sitting up. So making sure that everything is symmetrical. I do not believe in they are sisters, not twins, when we come to cosmetic tattooing, because you really want them to be as symmetrical as possible, but also looking as natural as possible. So yeah,
Absolutely.
I can take 3 hours just to pre-draw, just to get
Wow.
them perfect. And you cannot, for me, no question is a silly question, and be as picky as you want, because they are your eyebrows. If
Absolutely.
I notice a slight bit of hesitation, I will not start tattooing until I see your body relax, your tone change, your face expressions. Once I know that you are 100% happy, that's when I'll start.
Yeah. And that's really important because, our face is the first thing that everybody sees.
Yes.
And there are certain aspects of our face that everybody looks at, that being our eyes, which include our eyebrows, and then our mouth. So those things are quite important to a lot of people. And I think we don't actually pay much attention to that until we kind of don't have something, and then it's a great loss. So yes, making sure that things are absolutely correct, I think it's putting the patient first always. It's just making sure that
all
this
the time.
isn't about us, this is about them.
Yes, that's extremely important to me, because I did have a client that come in who had previously had them done years ago, and she was like, oh, I don't want to be too picky. I'm like, no, you need to be as picky as you want. It's perfectly fine. She goes, oh, I was told last time they're sisters, not twins, pretty much just to lay down and get it done. And I was like, no, not here. You don't have to do that here. It took me 3 hours to pre-draw her eyebrows, and that was fine.
Yeah.
I at 100%, I do not mind at all, because it's all about them. They need to be happy. They're walking around with them for years to come. I want them to trust me, and I want to build that relationship with them where they can trust me. So I do always make sure that we do a consultation first, because it's almost like they need to come and meet me and see if they like who I am as well, and vice versa. I like to meet them, and we need to make sure that we align with and we both understand each other, and especially I understand their expectations, and then they understand that if things are a little bit way out and they want eyebrows up here and their natural brows down here, and I'll explain to them all the reasons as why I won't go ahead and do that. Just basically interview each other, make sure that we're a good match for
Which
the
I think is
treatment.
really nice as well, because they are in such a vulnerable position when they're going through all of their treatment. They're having to just say yes to so many things that they might not necessarily choose in life usually.
That's right. Yeah.
To be in positions where we are in, it's all about giving them the control back.
Yes.
So, yeah.
100%.
Yeah.
Yeah.
So I'm going to ask one more question. Is there any specific care that they, like aftercare for their eyebrows, that they
Yes,
should be doing?
aftercare is extremely important. I give my clients all their aftercare, so then there's not an option if they want to do it or not. They've actually got it all, and I haven't had any issues at all because they've got everything that they need. So I give a waterproof silicone gel, so then you can still have a shower, you can still wet your hair, because you've got to keep them dry for 7 to 10 days.
Okay.
You can't go swimming. You try not to excessive sweating, heat. There's a fair bit of that you can't do for the first week.
Yes.
So yeah, and then just applying their aftercare cream as well. So I'll just make sure that they have their little pack, they have everything. I check up on them. I send through their aftercare. I don't just give a little card, because we all just put our card somewhere and lose that. So
true, so true.
I like to send it through, and that way they've got that to refer to. And I always let them know, do not hesitate to contact me, message me, call me, anything if they have any questions or concerns.
Perfect.
Yeah.
And is moisturizing like long term? These are tattoos. And I know with other tattoos, moisturizer is quite important to keep them looking as good as they can. Also sunscreening them.
SPF.
Yeah.
Like
Really
a hydrating SPF, I highly recommend, because it's protecting that longevity of the
So
tattoo.
if a patient wanted to contact you to actually come in and have their brows perfected, how would they do that?
I have my website, onpointbrowartistry.com, and on my social media as well. You can book through there, or you can send me a direct message, and my mobile number is also on my social media and my website as well.
Perfect. Now, whereabouts are you located? Because Australia is a big country.
I'm in Tamworth, New South Wales. I do video consults as well. So if you were looking at traveling a little bit, or me possibly going to different places, which I am looking into. Yeah.
Perfect. Now, if you're a practitioner and you actually want to get more into eyebrows as your thing, I think you have a course, don't you?
I do. I do have an online mapping course coming out, and will be doing face-to-face training as well. So that will be launching within the next month.
Perfect. And again, that's via On Point Brow Artistry?
Yes. So again, on my website and on my social media sites as well.
Fantastic. Well, thank you so much, Amanda. It has been wonderful talking today, and it's been really quite informative to learn about that kind of process from losing the hair to growing it back and getting the tattoos done.
Thank you.
All right, we'll catch you later.
All right, thank you.